4:40 overnight. Officers found a man unresponsive there right in front of the motel, and he later died there. Witnesses reportedly told police that they saw the victim in a fight with someone earlier in the night. And APD just released last year's
talking about as a state instead of the thousands. Today we had 299 new cases. Now that brings us to a total of 184,080 cases statewide. You can see that the number of New Mexicans we're losing still remains, higher, particularly if you look at that as a percentage of the 299 cases. Dr. Grace, I think, has done he's amazing. We're the team working on public health and this public health emergency in New Mexico are, in fact, some of the leading experts in the country, and we're very lucky to have them here. But, there's a lag between cases, hospitalizations, and then what we have to report, which is the number of people that we lose. It's still too many. Grim milestone, we're at 3,671, as most New Mexicans know. It's more than 500,000 across the country, and it's a terrible milestone. And to all those families who are grieving, you have our support and condolences. In hospitalizations, we're continuing to see the right kind of trend, 245 current COVID hospitalizations, 54 on ventilators. That, for me, I always look at those comparisons day to day, week to week. That's a little higher than I would certainly like it, but again, we're trending in the right directions, which means saving lives, keeping people from getting infections. You can see now that we have administered 520,029 doses. I'm sure that Dr. Collins will do this again. It's an invitation, Dr. Collins. At least one source has New Mexico, I think Beaker Hospitals, that we're at #1 in the nation today. And we're going to keep doing, I believe, incredible work getting New Mexicans vaccinated, and for New Mexicans who are registering and really getting to your appointments and taking this as seriously as you are. Quite frankly, this is the other side of a two-part equation. All the public health measures that we do, and restraining from gatherings and going to many places and getting vaccines. These are the areas that we are successfully deploying, and this is why we're doing as well as we are. Next slide. All right, so I've talked about this. We are on the road to recovery. This is exactly where we deserve to be given our hard work, and it's where we need to be to get as close to normal as you can pre-COVID. And we've talked about this at every conference and press conference, and I appreciate your patience, but it is one of those important points. This virus won't disappear. Its prevalence can be dramatically reduced and minimized. Our reaction to having this virus among us can always improve, and these strategies allow us to introduce more risk. And knowing that, there have been a lot of good questions about, well, as we get to green, given that there are still lots of categories, close contact businesses, for example, that aren't really addressed in the red to yellow construct, what happens as we get better and better? So green plus turquoise level. And I want to give you a sense about what that's looking like, given that we've got several counties at the turquoise level. So it basically means that every level of commercial activity can operate indoors now, everything, at a significant capacity. And that means including expanded dining options, which has been, one of the areas toughest hit, but also indoor and outdoor options for bars, theaters, event venues, and more. It's really that next phase where we know that we can manage high-risk activities because we're managing the public health behaviors, and we have so many New Mexicans who are now vaccinated. I want to just, before we go to the next slide, just reiterate one more time. It doesn't mean the virus is gone, and it doesn't mean all the risk is gone. And while vaccines are a game changer, and we knew that they would be, and we also know that individuals that have recovered from COVID have, some immunity conferred for some amount of time, we really do have to continue to be incredibly dedicated to all of the public health measures that we are all now confident about how they work and what they are. Masks, social distancing, hand washing, hand sanitizer, and minimizing the number of people we come into contact with, / minimizing the number of outings we have as individuals, because of course the virus travels with us or comes back with us. But we're succeeding at managing the virus, and congratulations, New Mexico. Next slide. All right, so I'm going to try to give, I am going to give because we've got a slide. Now that we've got 4 colors and each of them identify capacity limits a little differently, what I wanted to do is to give folks who were watching today a snapshot. We also put out this public health order that explained the changes yesterday, because these changes have been in effect since yesterday, because of course we do that 2-week update to the New Mexico map, and we can show you 2 weeks worth of data so that we're really clear that we are not just for a moment in time having an issue, that we're trending in the right direction. All right, so the new public health order is expanding capacity limits for a variety of businesses. So for example, indoor dining was 25% of max capacity. Now it's at 33% at the yellow level. So you can see that we've made some changes, improvements to the red to green, adding more risk, giving more opportunity to businesses because we're doing so well. Now, event venues, right? So these are large venues, could be a concert hall as an example. Now they were closed at every color level. Today, there are opportunities in every color. Closed before, today, 25% now outdoor. If you get in yellow, if you get to green, and we're showing that, 50% outdoor, 25% indoor. You get to turquoise, 75% outdoor, 33% indoor. Recreational facilities, things like aquariums and zoos and amusement parks, they were either completely closed or really highly restricted in all colors. Today, based on how well we're doing, you can now do 33% capacity outdoor, 50% if you get to green outdoor, and 25% indoor. You get to turquoise, 75% outdoor, 50% indoor. And I really want folks to follow, the inclusion of expanding and introducing these indoor, because close contact is the highest risk. And close contact where we're eating or drinking, highest risk, right? It's because we have to take our masks off. Bars and nightclubs closed, every color. All right, today, because we're doing so well, and a lot of that has to do with vaccines, now still closed in yellow. But once you get to green, 25% outdoor. The moment you get to turquoise, 75% outdoor and 33% indoor. So a complete introduction to operating businesses that, because of their close contact issues and because that you can't wear masks, have been frankly closed for the duration of this pandemic. And for so many of us, both patrons who have been waiting, and for us, for supporting our local businesses that, as we all know, have really struggled in this environment during this pandemic. I believe that this is welcome news, and it is a sign of incredible recovery and progress. Next slide. Okay, I already said this. I'm just going to do it quickly one more time, that these things are always contemplated. We aren't going to shift the mask mandate. Maybe someone will talk, or he'll just do it on his own, Dr. Scrace, about what you can do to make your masks more effective. You got to stay socially distanced. You got to be 6 feet apart. You got to make sure that you're minimizing, right, these droplets from being able to spread, and then wash washing your hands. This is a basic public health practice that until this pandemic, I think we all realize now that we probably weren't as vigilant about. And I think most New Mexicans have become pretty frequent flyers for making sure that hand sanitizer and sanitizing our cars and our homes, that we're engaged in that in a regular basis. That vigilance by itself, quite frankly, could take us into green and turquoise levels. But we haven't as a country, and arguably we haven't as a state, adopted them as rigorously as frankly we should have. But the vaccines and the improvements here, both, we are improving. Our public health practices are improving, and I'm incredibly proud of us. And it's worth saying we are going to be in, I believe, really good shape because we are improving our vigilance in public health efforts. Next slide. All right, I just want to try to, given that we've got 4 colors and that we've also changed what's in yellow and green, I want to give folks just a sense about how close to normal this should feel. So you can see by these icons, look, if you're in retail, we're not really going to be doing metering. It's 75% of maximum capacity, so nearly full. Again, you got to be cognizant that you got to work to socially distance and wear masks. Food and drink establishments, which have been really tough because, again, close contact, no masks. You know, you're at 75% of indoor maximum capacity and 75% of outdoor capacity. So again, nearly no restrictions at all. Large entertainment venues, which we weren't doing at all, when they include movie theaters as an example, now you can be at 33% of maximum capacity. Notice that we're really building that quickly because we're doing so well. And 75% of any of those outdoor spaces. Bars and nightclubs, 33%, 75%. Places of lodging, no occupancy restrictions for anyone, any place of lodging that's New Mexico Safe certified. And notice we're still really pushing that because we know those COVID safe practices are in place and are really make a difference. Kudos to the Recovery Council for getting all of those done for all businesses, and 50% of occupancy for everybody else. Look at the mass gathering limits. In red, we're at 5, 150 persons, 200 vehicles, really changing that environment for introducing events and celebrations and recognitions for families in any number of circumstances, and really preparing for tourism. Close contact businesses, again, 75%, recreational facilities, 50% indoor, 75% outdoor, houses of worship, 75% of any enclosed space on the premises, and all other businesses, including all other non-essential retail stores and gyms, again, 75%. Basically, very few restrictions, and we wanted to stay here long enough so we know we're holding and you're as close to normal as you can get. And I'm very excited about this turquoise level, and congratulations to the counties that are already there. Next slide. Now I'm just going to highlight some differences instead of going all the way through it. You can see that there's a big jump in the mass gathering limit from green to turquoise, but you can also see that it's exponential in terms, 5 to 20 and 120 vehicles, really introducing that risk, but introducing it in a responsible way. You're either at 50% or you're at the 25%, but we're introducing again to green large entertainment venues, bars and nightclubs, and expanding close contact businesses, other businesses, that catch-all, and recreational facilities. So areas that we've been, because they're high risk, we can see that we're doing so well that we can now add them back to the red to green framework and begin to visit those businesses safely again. Remember, limiting that contact and our public health practices are going to be key here. Let's go to the next slide. Yellow, I'm going to show again, right? 10 instead of the 20. So you see a doubling, 80 vehicles. You can see that basically our capacity limit is about 33%. For some, we're starting in areas where we didn't let you do that at all. And we introduced large entertainment venues, again, into yellow, which we had not done before. Bars and nightclubs, still a little bit too high risk, we believe, based on the modeling for yellow. But as you can see, and if you can remember, they're squarely in green. Places of lodging at 60%. In New Mexico, Safe Certified, 25% who aren't. Again, remember that we want folks to get Safe Certified. We want you to get to that 60%. We know that makes a huge difference on our ability to operate these businesses. So we want to encourage folks to do that. Next slide. And red. And in the red level, this is really important. I think there's a sense that while we've got 4 counties in red, and I know that, it's disappointing when you see that map, but they are moving. We can see that based on the positivity rates in each of these counties and the fact that as a state it's gotten lower than 3, and we haven't seen that in a long time. We are absolutely moving now much quicker than we have been, and that is important. I mean, we're all on that sort of precipice. But if you don't have this red level where you move too quickly, it also has significant negative potential circumstances for the other surrounding counties, right? We move. So essential retail, 25%, but not everything is closed. This is the whole point. Food and drink, no indoor, but outdoor can operate. Large entertainment venues cannot operate. Bars and nightclubs, but you can do lodging. Mass gathering, 40 vehicles, 5 persons, really small, because we know that this person-to-person, particularly family gatherings, are really risky. Close contact businesses, 25 or 10 customers, whatever is smaller. Recreational facilities, 25%. Houses of worship, 25%. All other businesses, 25%. So again, it's not that everything is closed, but it is smaller to make sure that you reduce the amount of virus that's moving around in your community so that when you introduce risk, you can stay where that you are and keep building. I believe that is all of my slides for today. And I want to thank everyone for going through each of these levels. You can go to cv.nm. Oh, yep, I think that's true. nm.health, and you can go right to those maps. I want to encourage folks to look at that data, to look up your county, and of course we're always available for questions. And I'm going to go right to Dr. Collins to talk about how we're doing for vaccines today. Dr. Collins.
Yes, thank you, Governor. Well, good afternoon. I want to discuss with you where we are with vaccines. So we've administered 520,029 vaccine doses. So New Mexico is the 3rd fastest state for vaccine administration. More than 20% of New Mexicans are partially vaccinated, and more than 10% are fully vaccinated. And we're expected to receive an additional 7% increase in the number of doses next week for a total of 77,720, which is really phenomenal. Additional good news, more than 650,000 New Mexicans have registered for the vaccine, and I'm going to reiterate, please register at vaccinenm.org. Next slide, please. So New Mexico is using its doses more efficiently than any state in the country. And we're ensuring that while supplies are limited, those doses go to the places where they can save the most lives and stop the spread of this virus most effectively. We have now given first shots to more than 1 in 5 New Mexicans aged 16 and older. We've now fully vaccinated more than 1 in 10 New Mexicans 16 years of age or older. So as we use our doses more efficiently, we're really rising to the top in the country for vaccine distribution. We're number 3 in vaccine administration rates. That means doses given per population, but we are number 1 in terms of percentage of doses used. So we're really doing a great job. Next slide, please. So I want to highlight some more good news. We are anticipating that Johnson & Johnson, that their vaccine will be approved very soon, and that's a one-shot vaccine. It's highly effective against severe COVID, so hospitalizations and deaths are reduced. Keep in mind that all vaccines approved by the FDA are safe. And so we want to keep that on the radar as we think about the vaccine doses and making sure people get shots in arms. That Pfizer, Moderna, and hopefully J&J will all be available to us, and you're in good hands with those vaccines. Next slide, please. So our mission, as we think about equity, which I'm very passionate about, we want to vaccinate New Mexicans efficiently and equitably. We are targeting weekly equity allocations to the most vulnerable and exposed communities. We are focusing on reducing morbidity and mortality and reducing viral spread. Next slide. So how do we ensure equitable allocation? One of the factors is looking at the CDC's Social Vulnerability Index, which is really an assessment of the resilience and the resources a community has to deal with a natural disaster. And the more vulnerable you are as a community, the higher your index. And these estimates are based on kind of 15 factors that relate to the composition of your household, your income, also looking at your minority status, language, housing, and transportation. So those are all key for assessing social vulnerability, and you end up with a score between 0 and 1, and the higher the score, the more vulnerable you are. Next slide, please. So when we look about allocations in areas with a high social vulnerability index on the left-hand side of this slide here, you'll note that there are counties like McKinley and others that are really vulnerable when you look at that SVI. When we look at areas where we've had spread or high case volumes, thinking again McKinley, Chavez, and other counties, these are the factors, the social vulnerability as well as high caseload, that we will use to determine how we allocate our doses moving forward. Next slide, please. And I'm going to pause there for just a second. If you noted that Rio Arriba was really white, could you go back? I want to just make sure people are clear on this. That particular county, when this data was collected by the CDC, there was not enough data to rate this, and so that's why it's white. It's not that it's not considered, it's just that there's not enough data to give it an index. Okay, next slide, please. So what we're doing to ensure distribution equity is for the 3 weeks worth of allocation, we have a plan for reaching the vulnerable populations. And really we're looking at taking a portion of our doses and ensuring that they go to those vulnerable populations. But keep in mind, we're getting more doses each week. So it's not like we're taking away doses from any one group. It's just we're being very strategic about allocating to the most vulnerable. Next slide, please. So in order to ensure equal access, some things that we're working on are ensuring that we have providers in areas with high SVI and high COVID positivity. And you can look, we've broken it down into 5 regions. And we want to also use mobile vaccination teams and clinics in all these regions to reach those who are in remote areas who may not be able to easily get to a vaccine provider. Next slide, please. Also, we're really focusing on vaccinating our seniors. Again, looking at the group most at risk for morbidity and mortality. So we're going to increase vaccinations for seniors by 10% over the next 2 weeks. And we want to give seniors, and we are giving seniors, extra time to respond to appointment invitations. And if you need support with registration, please do remember the number 1-855-600-3453. You need to press 0 for vaccine questions and then 4 for tech support. And if you need additional accommodation, transportation, wheelchair, we will work with you to ensure that that happens. And next slide. So as far as long-term care vaccine clinics, 100% of our nursing facilities and assisted living facilities have completed a first vaccine clinic. We are really proud of that. 90% of nursing facilities and 75% of assisted living facilities have completed a second vaccine clinic. And all state-run facilities have completed 2 clinics. And we're looking at a 3rd round of clinics in March. So that's really exciting. Next slide, please. And we're doing special outreach for seniors. Our Aging and Long-Term Care Services Division will host 4 vaccine clinics throughout the state in partnership with senior centers. And we're coordinating also with Department of Homeland Security and Emergency Management. And so we're really making sure that we get that most vulnerable group and get at least 60% of them vaccinated. Next slide, please. Okay, I'm going to turn it over to the master now, Secretary Dr. Grace. Thank you.
Thanks so much, Tracy. I appreciate your amazing work on vaccines. Thank you, Governor, for explaining the new system in great detail, and I think I understand it pretty well now as a result. I did want to tell a little story about our vaccine effort, just to paint a picture for all of you, because this is an amazing work that's being done by our team. We had a very detailed presentation at our 7 a.m. COVID meeting that we have Monday through Friday. Just to paint that picture, there's 6 or 7 cabinet secretaries there every day that are managing the pandemic. Laura Parahone and Tracy Collins, Secretary Collins, presented this equity plan in even more detail than you've seen. And every single secretary spoke up and said that this is incredibly inspiring, and this is exactly why I became a cabinet secretary, and this is, I'm just so proud to be a New Mexican and to be working to enhance the equity in the vaccine distribution. So this is a big deal to cabinet secretaries, Tracy's work, Laura's work, and I think it's a big deal to New Mexicans, and I want to highlight that especially. I want to just go through a couple different news of the day, as the governor said, topics. First one is just about masks, and the federal government announced that 25 million masks will be delivered to community health centers, particularly low-income community health centers, where most of them are across the United States, to make sure everybody can have a mask. I want to reiterate what I said last week. As we reopen, nothing is more important than 100% of people wearing a tight-fitting mask. No vents in them, please. You know, there's do's and don'ts of masks. You're pretty familiar with them, but remember, it needs to fit tightly around your face. When you breathe, it should move in and out a little bit. You should feel that as the air flows through the mask. You know, there were a couple reports this week of outbreaks in gyms, and one was from the CDC, a detailed report. And if you read the report, the particular gym in question required everyone to wear a mask in the gym except when they were in an exercise class. And so no one, I think, is really surprised that there was an outbreak of coronavirus as a result of that lack of discipline around everyone wearing a mask. I know it's a little tougher. I still wear a mask when I exercise, a little harder to exercise. But please, everyone, remember that even with the vaccine, this is our first line of defense. First line of defense is all the COVID safe practices. Second is contact tracing and isolating folks, which I'm going to talk about a little bit. And third is the vaccine, but that's growing in significance. Alex, next slide, please. You know, I wanted to mention a little bit about school reopening as well, and I just found out and had a chance to print a press release. So members of the media, this went out from the Public Education Department just a couple hours ago. We're seeing positivity rate down in schools, testing rates going way up as kids and teachers return to in-person school. There's an excellent reentry guidance that forms the foundation of the work we're doing to reopen schools, that prioritizes the health and safety of our students, staff, and communities. It maximizes the amount of safe in-person learning opportunities that we have. And all the decisions are based on science and data to the extent that we have science and data, but we've been fortunate there's a lot of emerging data on school safety, even in the midst of a pandemic that's coming out. I think the other thing, if you read through the guidance, is the cleaning, the maintenance, the infrastructure, the ability to enforce masking and 6-foot distancing in schools is critical to it being successful. And I think that actually in our modeling team in December, based on the assumptions and the kind of basically rigid enforcement of mask wearing and 6-foot distancing in schools, our modelers and the folks from Lionel felt the child is safer and less likely to contract a coronavirus in school than they were outside of school. And I've gotten a lot of questions and emails and lately about, well, why is sports, why does that have to be connected to in-person schools? And my take on that is that, there's this infrastructure, there's cleaning, there's maintenance, there's a whole staff. School is set up to be safe, and that's a foundation that we need in a school to build sports on top of that and keep that safe as well. I know some schools that went back in person are now reopening sports, and I think that infrastructure that Secretary Stewart has created is an essential piece of that. And so I just wanted to review that and let you know that the early returns are that it's going very, very well from an epidemiologic and test positivity and case count point of view. Next slide, please. I wanted to tell you about a new thing from our epidemiologists, Christine Ross, Chad Smelzer, and that team. In December, and one of your reporters asked a question about this, CDC released some guidance for 7-day and 10-day quarantine and how that might be done. We did a thorough analysis of that. We felt like 10 days would be the best for New Mexico, but we needed to wait until case counts came down to implement that new element, and case counts have come down, and so you'll be seeing communication from epidemiology that we're shortening the quarantine period for 10 days. There are benefits to this. You can see on this little graphic, these are the post-quarantine transmission risk by day. So on day 1, after you go into quarantine, you have a 60% chance of transmitting, and it comes way, way down, and you can barely see the numbers. They're all quite low, days 10 to 14. And so it's been shown that the 10-day quarantine can have a higher compliance rate because it's 10 days. It's not 14 days. It also makes the period of time for isolation and quarantine the same at 10 days, which will reduce our emails asking why quarantine is 14 days and isolation for cases is 10, but we've explained that a lot. And then it just reduces the burden on individuals of having to be in quarantine. That's a lot of time to take off of work and have groceries brought in and things like that, and so many other things. And so we feel like this is the right time, and thanks so much to the folks in epidemiology for bringing this forward. Their documents will be revised soon. But one last caveat and reminder is please, you still need to take your temperature. If you have symptoms, you should still stay home and work. It doesn't matter if it's day 11 or 12 or 13 or 14. Do not go to work with symptoms if you've been exposed to someone with coronavirus. So wanted to update you on that. That's news of the day being today. Next slide, please, Alex. We've got just our usual epidemiology data. Here we've got the New Mexico map, dotted line on top, sorry, not map, but the number of cases with that very tall and very wide, very, very wide peak that we've just been through and now gradually coming out of. Pay particular attention to the very end of the curve. It's still down sloping. We have our fingers crossed that will continue here in New Mexico. And on the next slide, I want to show you some data. One last thing, we say this every time, though, with the weather. Last week we had a little bit of lower vaccination rate, but we're now 33 times the number of vaccines per day as cases per day. That keeps going up, an unquestionable formula for success here in New Mexico. Lastly, the other 5 lines are the 5 regions of the state, and you can see for the most part they're all still trending downward. Alex, next slide, please. On the next slide, though, you can see that the cases in the United States on the left there, look to the extreme right of the curve, have started to plateau, and actually cases worldwide have also started to plateau, and so everyone is very concerned. We're all watching this closely, but if we all wear a mask, and with our incredible success in vaccines, that should help us to keep from seeing another wave after this one. And on the next slide, I believe I've got the latest LANL modeling. This is my favorite slide. I would wallpaper my house with it if I could, but a little bit complicated. But the dots are just input that goes into the model. You can ignore those. The blue line is what we would be seeing in terms of cases. And Alex, maybe you can point to where we are at the end of the month at the sort of bottom inflection point lower on the blue line where it starts to tick back up. So what this says is, actually with reopening, we would expect to see an uptick in cases, and this is what we're projecting. But because we're doing so well with vaccines, we're really on the red line trajectory, which is the lower line there, and you can see it does not tick back up. This assumes we all keep wearing masks and doing all the other safe practices. Remember, the red, yellow, being yellow or green or turquoise does not mean it's time to take off our masks. We have to keep them on. I'm very encouraged by this, but we're now up to the point where we believe the vaccine in our state has lowered the case rates by 25 to 30%. That quarantining, as I just mentioned, still a more important method of controlling spread of the coronavirus than the vaccine. But I think sometime in the next couple of months, that will change and the vaccine will be #1 as well. A few more things I wanted to show you today. Next slide is a slide of, again, cases on the top, similar to what I already showed you for the whole state. Hospitalizations coming down nicely. It's been, we haven't had 245 COVID cases in the hospital, a number that low since the very end of September, first week of October. Our healthcare professionals are getting a much needed rest. Some are taking vacations. And finally, we're seeing that downward trend that does lag, but in deaths as well. And we're hoping to see single digits sometime in the next couple weeks. One feature of that downward trend in mortality, if I can see the next slide, and this is to build on the great news from Secretary Collins about nursing homes, and a shout out to Katrina Hotram-Lopez, our secretary there. But you can see that while COVID deaths were going up in that shaded area on the left graph, that's when the vaccine rollout began. And if you all remember, nursing home residents were one of the first groups. And so we saw an immediate, I thought it would be quick. I didn't think it would be this quick, an immediate downward trend in deaths, even while cases throughout the United States were going up. And and on the right, we've got our own data. The curve is a little choppier because it's a very small number of deaths each day, but you can see that on a 7-day rolling average coming down in a very similar way. And earlier this week was the first time since April that we went a day without a death in a nursing home. So I'm really excited. I'm a geriatrician. I always say these folks, these people over 75 are my people, and I'm delighted to see that we have such an effective method for reducing mortality through the vaccine. And even the new vaccine coming out, very, very impressive in terms of reducing hospitalizations and deaths. None at all so far. Okay, next slide. I also want to point out that one thing we really have going for us this year, and one idea that helps us understand that masking really works is we've had basically no influenza to speak of. A couple of cases, as to my knowledge, we haven't had any deaths, but you can see the number of thousands of deaths in the previous years of influenza. And also, I think we had a lot of questions and comments at the very beginning of this and through the summer, contending that really influenza was no worse. You know, COVID was really no worse than influenza, and what's all the big deal about it. And I think now you can see these, 25 times the death rates sort of illustrates that case. But still good news, masking, social distancing have had a dramatic effect on influenza. You might remember we talked about that last summer in the southern hemisphere, and we're really hoping to see that here in the United States, and we have. So more good news. Next slide, please. Just a brief stop on the gating criteria, which have now become relevant to all of us again. We are hitting on all cylinders. The only thing left is to get that case count on average down below 168 per day in New Mexico, and I think we are still on our way there. The reopening may slow that a little bit, but the vaccine, as we talked about, is speeding it up. Testing going well. Test positivity, as highlighted by the governor, no county over 10%, which is great. And in fact, our state average is now down to 3.7%. Again, a long time coming. Really glad to see this. And contact tracing, because of the lower number of cases, is actually happening the faster it ever had. And that's important because of the importance of isolation and quarantine to controlling the pandemic. I think I only have one more slide. If we can go to that, well, I'll turn it back to the governor. The virus is mutating. We're watching that closely. I don't have any science to update you on today. We've had 2 more cases in New Mexico of the B117 mutation. Those are contained. No South African or Brazilian that we know of. Our labs are coordinating efforts to do that screening through the PCR testing and additional sequencing. Again, a reminder to get tested if you've been exposed, if you have symptoms, if you're concerned that you have coronavirus. And we are all going to need to keep doing what we're doing. This reopening is not something like a prize we've won and now we can go back to normal. The reopening is something we can do if we continue the COVID safe practices that are listed here. And the governor went through them again and emphasized them. We all do every time we talk. So with that, I just want to thank everyone in New Mexico who's participated and worn a mask and done the things that are concurrent and go along with the public health orders, and also everyone in state government who's worked so hard. That partnership between government and industry and members of the community is what has gotten us here. That same partnership is what has us #1 in the country in vaccinations, and just delighted to be able to be here today with so much good news. Thank you very much, and Governor, I'm going to send this back to you.
Governor, you're still muted.
Yeah, and I'm going to just let everyone know, and of course the folks watching at home and the press, we've had some network issues here, so I've been on and off this presentation. I apologize. And if in the middle of a question I'm off, plenty of experts who will jump in and I'll work to get back on. And I apologize in advance. We've been struggling with coverage and network reliability, frankly, all day today, and hope that I don't have any more problems today. But why don't we go to questions?
Thank you, Governor.
Lujan Grisham. It's Governor Michelle Lujan Grisham right now wrapping up her press conference. We're going to have more on the details of what was said. A lot of information coming up for you at 5 right here on KOP4.
Recital the 2nd year you were there?
No.
Was she in a recital the 3rd year she was there?
Yes.
Did you buy her costume?
Yes.
Did you pay for it?
No.
It's going to be much easier this way. So you didn't pay for the costume the third year, because that's part of her lawsuit. And your daughter did use the costume. Do you know how much she charged for the costume?
The total bill that month was $400.
They saw the victim in a fight with someone